Hi, my name is Daniela Asastia, and today I'm going to be talking about a solution to the increasing shortness of staff in nursing. So this problem arose in 1998, and it resulted because of a combination of factors, including the rising demand, little growth in RN wages, which RN is registered nurse, demographic changes in the RN workforce, and the decreased supply of the working RNs, and a stressful hospital workplace environment that kind of turned people away from nursing. So this has created several problems over the years for nurses. They have started to overcompensate for the people who obviously aren't working since they are short-staffed. They are facing extreme tiredness, and which, as a result of them being tired, have made the quality of patient care lessen, and patients are not receiving as well of care as they should be if they had a full staff. So over here, this graph kind of shows over the years that the demand is on a constant rise, and the supply at one point was going up slightly, as you can tell right here, and then it started just to go back down again after about 2012. So solutions previously tried was the IOM, and that is the Institute of Medicine, and they came out with a lot of documents that emphasize the importance of teamwork and how improving efficiency in the quality of hospitals would happen if they had more effective communication, teamwork, and problem solving to address the nurse shortage and minimize its impact that the providers and hospital executors were to share in the recognition of the problem. And so all of that kind of meaning that if they had better communication and better teamwork skills, then it wouldn't be such a problem and the quality of care wouldn't be reduced. So Contino, which is a woman that is very popular in the nursing field, came out with a lot of 10 steps to kind of fix the nursing shortage. And so one of the main ones is that since there's such a demand of nurses, that nurses can walk into a hospital and meet with employers and basically ask for higher wages, and that they would go along with it because they don't have that many nurses. So she says that nurses can use this tactic to be hired and fix the shortness of staff in hospitals and other medical facilities. She says that having an adequate staffing often decreases the turnover. So also another problem that occurs because of the nursing shortage is that nurses who aren't adequately trained and the best of their class or the best nurse that they could possibly hire, they are being hired because they don't have that many nurses. So the National Institute of Health really focused on improving recruitment. So they want the best nurses to give the best quality of care, but if they do this, then they may not be getting the amount of nurses that they need since there is such a shortage. So this graph is showing that between 2000 and 2020, the shortages of RNs will increase. So in 2000, 30 states were estimated to have shortages, but by 2020, the number of states estimated will grow to 46 states. So my solution is a 4-part plan, and it involves delegating the work, raising salaries, educating the future generations, and having a lot of rewards and scholarships and just things for nurses to look forward to and continue to grow their education in nursing. So delegating work is a big thing that can help nurses stay on top of their patients more. And so just having people in the hospital that can do some of the tasks that would really take time away from nurses actually doing things that can be very serious, like for example taking vitals. A lot of people in a hospital are capable of doing this, so if they had someone who can just be on a rotation of doing strictly that, then that would make the nurses' lives a lot easier and really they can focus on the more severe patients and really give them the quality of care that they need. The second part is raising the salaries. The average nursing salary is about $75,000, and if salaries were raised or expected to be raised, so like when a nurse goes in and they're having their interview, if at some point there is a raise in their field, it would give them something to look forward to, and also the field would be a lot more desirable for upcoming generations. So education for these upcoming generations is huge, and people really need to be informed of how important nursing is, and that there are so many different paths that you can take when you go into nursing. So there was a survey done by the Institute of Health, and they surveyed that most nurses who have children, they are guilty of complaining about their jobs, in which that discourages the children to become nurses. I remember a specific part, and it was saying how you wouldn't see like doctors and lawyers kind of not pushing their kids to be a doctor or lawyer. Like they want them to be just as successful. So nurses need to be doing the same thing of really encouraging the next generations to become nurses. So rewards and scholarships is something huge just to have them look forward to, and it keeps people interesting. And so winning prizes, obviously, like everyone wants to be a winner and have something to look forward to. So if students knew that at some point their college may be paid for as an incentive, that would be a perfect time to start communicating it into the world so that people know that if you go into nursing, you could also be fixing the shortness of nurses and be giving more of a supply to the patients. Thank you so much. Bye-bye.